cracking down and reimposing restrictions.
Los Angeles hoping to curb the spread by boosting testing. This is the scene at a makeshift facility at Dodger Stadium. Hundreds of people
This
in
is
their
not
cars
good.
waiting to get tested. This morning, Dr. Anthony Fauci is going to join us with the latest on the surge. But first, Trevor Ault is in Bismarck, North Dakota, one of the hardest hit states right now. Good morning, Trevor.
Good morning, Michael. You know, many rural states like North Dakota were spared from the first wave, but right now, essentially, the entire country is in the grips of this virus, with doctors and nurses telling us many hospitals are running out of space and manpower, and many patients are running out of time. This morning, coronavirus continues to rage, suffocating nearly the entire country. The White House task force reporting 42 states now in the red zone, with a record 145,000 cases logged Wednesday. November is on pace to be America's worst month fighting the virus so far.
I can assure everybody that
this is what they're saying.
They don't want to be one of my patients. You don't want to be this sick.
Fear.
You don't want to have to be on a ventilator.
Dr. Hillary Faust is on the front lines in Wisconsin, where confirmed cases now rival the numbers New York City saw in the spring.
Oh, Lord.
As healthcare workers become infected
what are
there,
we gonna do,
one
people?
hospital system is turning to an emergency volunteer registry.
We are reaching out to retired nurses. We're using students who have come up and have come to the forefront and volunteered their services.
North Dakota's governor going even further, allowing infected nurses to keep working so long as they don't show symptoms. With hospital beds there more than 90% filled and infection rates above 20%.
Here we go again. They're filled, people.
Right now, it's the hardest hit state in the country.
They're filled.
We really believe that the accelerated growth of number of cases and hospitalizations is not sustainable.
Other hospitals running out of space to care for the crush of COVID patients. A Michigan nurse says this week she had to treat one of them in a storage room. That state, one of several consistently topping 6,000 cases a day. As nationwide deaths have climbed 17 days in a row. 1,000 American lives lost on average every 24 hours.
Stay home when you can. Work from home.
There he is. There's the man.
For another lockdown
That's the man.
Looming as cities and states reinstitute restrictions. Experts with the Policy Lab at Children's Hospital of Philadelphia recommending students in areas with rapidly accelerating transmission rates revert to online learning. In New York, closing bars, restaurants, and gyms at 10 p.m. and limiting indoor gatherings to 10 people.
Ooh, yeah.
Bars, restaurants, gyms, house parties. That's where it's coming from, primarily.
I don't know, people.
And those are the ones that we can address.
We're gonna go into civil unrest. We're gonna have anarchy. Where's it gonna go, people? What are we gonna do? It's up to us. We gotta take care of this. We gotta nip it in the bud, people. And you know what I mean?
All right, Trevor, thank you very much. And Dr. Anthony Fauci is joining us now. We know you have long days.
Hey, Fauci, what's up, dude?
Spending some time with us this
You're
morning, sir.
the best,
Right
buddy.
to it. We've heard in
You
Trevor's
are the
report,
man.
and others are saying that November could
You
be
are
the worst
the man.
month to
And
date
you know what I mean?
in fighting
Come on.
the coronavirus.
You know what I mean?
What needs
You know what
to
I
be
mean?
done to flatten the curve and to stop this surge
Yeah,
in
look,
new cases?
flatten
that
the
we're
curve,
seeing,
people.
Dr. Fauci?
Gotta flatten that curve.
What we need to do
Flatten
is
that
what we've been
curve.
talking about for some time
Means
now.
we
but
live on
really
a flat
doubling
plane,
down
maybe?
on it. There are
Oh,
certain
I couldn't get it.
fundamental,
Oh,
baseline
flatten the
things
curve
that
of
you
that
can
there.
do.
Yeah, you gotta flatten that curve.
Universal and uniform wearing of
Oh, yeah.
masks.
You gotta flatten that curve,
Avoiding
people.
crowded
Come on now.
congregate situations, keeping physical distance. Even though the weather
Oh, my
is,
goodness.
in the season of cool weather, try as best as possible to do things outdoors, preferentially over indoors, and wash your hands as frequently as you can. They sound very simple.
Second
And given,
lockdown,
the
people.
really
Second
very
lockdown.
difficult
Food shortage.
challenge we're facing,
Be
one might
prepared.
think that doesn't make any difference. It
Be
really
prepared.
does, Robin. We know that
Food
as a fact.
food
We know
shortages.
that through experience.
Lockdowns.
When do you believe that a vaccination will be made
Next year.
available for the majority
Maybe 2 years
of
from
the
now.
American public?
Maybe 5 years.
Obviously, the first ones that are going to get it are people like
First
healthcare
ones, people
providers who
look,
put
ones.
themselves at
So you're gonna
risk.
get more.
And then there are those
More
who are
jabs.
highly vulnerable. Over the months from December, which when it will start in December, then you get to January, February,
Yeah.
March, April.
That's
we
the
hope
darkest
that by the
winters.
time you get into the second
Darkest
quarter,
winters,
end
remember?
of April, early
They
May,
said that.
May, June, somewhere around
President-elect.
that time, the ordinary
Biden
citizen
man
should
said
be able
darkest
to get
winter.
it.
You can imagine people anxious to know the timeline there, so thank you for that. But let me ask you this, Dr. Fauci. The situation that we find ourselves in following the